Okay, let's unpack this. If you're a dog owner, what we're about to dive into is, well, it's absolutely critical knowledge.
Hmm.
It's about a hidden danger, an everyday ingredient that's, completely harmless to us humans, but can be devastatingly toxic to our dogs.
Yeah, it really can.
We are doing a deep dive today into xylitol toxicity.
And to guide us through this, we've uh, pulled together a stack of sources: veterinary information,
Yes.
clinical guides, expert summaries, the works.
Right.
And our mission with this deep dive is pretty clear. We want to understand exactly what xylitol is, why it's uniquely dangerous for dogs specifically.
Hmm.
We want to expose all the surprising places it might be hiding in your home, tell you what signs to watch for if you suspect your dog got into some,
Yeah.
and most importantly, empower you with the knowledge of what you need to do and how to protect your pet.
And here's the surprising reality that makes this so urgent, I think. You probably know it's in sugar-free gum, right? Everyone sort of knows that one.
Right, that's the classic example.
But our sources show it's popping up in products you'd never suspect, like certain peanut butters, some baked goods, even medication sometimes.
Exactly. This stuff is becoming, well, kind of ubiquitous, and that unexpected presence is a major part of the risk, isn't it?
It really is. So let's jump right in. What exactly is xylitol and why is it okay for us, but such a problem for our dogs?
Okay, so xylitol is what's called a sugar alcohol. You can think of it as a carbohydrate that's processed a bit differently in the body than regular sugar.
Okay.
It tastes sweet, has fewer calories, which is why it's used in a lot of sugar-free products. For humans, our bodies absorb it slowly. It doesn't cause a big spike in blood sugar or insulin, generally considered safe.
All right, sounds innocent enough on the surface, but here's where it gets really interesting and, frankly, alarming from a canine perspective. How does a dog's body react so differently?
Yeah, this is the absolute critical difference. When a dog eats xylitol, their body treats it completely differently than ours does. It gets absorbed incredibly rapidly, very efficiently into their bloodstream,
Okay, much faster than in humans.
much faster. And crucially, the dog's pancreas. It mistakes this xylitol coming in for a massive surge of actual glucose, real sugar.
Ah, so the pancreas gets tricked. And its job is to release insulin when it sees sugar.
Exactly. So it releases this huge, totally disproportionate amount of insulin in response to the xylitol. It's like, think of like a fire alarm going off and flooding the entire building with water when only a tiny candle is flickering.
Okay, that's a good analogy.
And this huge insulin release then goes after the dog's actual blood glucose, driving it down incredibly rapidly and severely. And that's profound hypoglycemia, dangerously low blood sugar.
So the immediate threat is this sudden, really dangerous crash in blood sugar. And how quickly are we talking?
Yes, that's the most common and usually the most rapid effect. Signs related to that low blood sugar can appear incredibly fast, sometimes within just 15 to 30 minutes of them eating it.
Wow, that fast.
But, and this is important, our sources also highlight that with some products, like certain types of slow-release gum, the xylitol is absorbed more slowly.
Ah.
So the signs might actually be delayed for 12, maybe even up to 18 hours.
Mm-hmm.
That's why you've got to be vigilant, even if the dog seems perfectly fine right after you think they might have eaten something.
That timing variability is really important to know. Okay, now the sources also talk about liver damage. Is that connected to the low blood sugar or is that something separate?
It's actually separate, and that's another really concerning part. While the hypoglycemia is the common immediate issue,
Mm.
xylitol can also cause direct toxicity to the liver cells themselves. It can lead to acute liver failure.
Okay.
This usually happens at higher doses. The general number is above 0.5 grams per kilogram of the dog's body weight. Though, some sources suggest you might see early liver enzyme changes starting as low as zero point 0.2 or zero point 0.3 grams per kilogram.
Right.
What's really kind of fascinating and scary here is that this liver damage can happen independently of the initial hypoglycemia.
Yeah.
So a dog might have only mild low blood sugar or maybe none that you even notice,
Mhm.
but still go on to develop severe liver failure hours or even a day or two later.
So it's a double threat, potentially rapid, severe low blood sugar. And at higher doses, this delayed but potentially devastating liver failure. Is that right?
Precisely. And if the liver starts to fail, it can't produce the proteins needed for blood clotting. So that can lead to bleeding disorders, what vets call coagulopathy.
Okay.
And our sources are pretty clear that unlike dogs, cats don't seem to be affected in the same way. So this is really primarily a canine concern we're talking about.
Good to clarify.
And just to put those doses into perspective again, our sources mention specific thresholds. Doses above roughly 0.075 to zero point 0.1 grams per kilogram can trigger that dangerous hypoglycemia.
Okay, that's the lower threshold.
Yeah, but you generally need that higher dose above zero point 0.5 grams per kilogram to be seriously worried about liver failure kicking in.
Got it.
Think about it. A single piece of sugar-free gum can easily contain, zero point 0.3 to over a gram of xylitol. That could easily cause hypoglycemia in a small dog.
Easily.
And just a few pieces could potentially put even a medium-sized dog into that liver failure risk zone.
Knowing those numbers really drives home how dangerous even a small amount can be, especially from those concentrated sources like gum. Which brings us to the big question. Where is this stuff hiding? You mentioned it's not just gum anymore.
Yeah, and that's the really tricky part now because the list of products containing xylitol just keeps expanding. It's crucial, really, to be a bit as a detective in your own home.
Okay, so let's highlight some of the most common and maybe surprising places our sources point to. Where should people be looking?
Well, like we said, sugar-free gum is still number one. It's potent, it's common, dogs often find it. But also look out for other sugar-free candies, mints, lozenges, even some sugar-free chocolates or baked goods.
Right.
Toothpaste and mouthwash are big ones. Please only use toothpaste specifically made and approved for dogs. Human dental products are a major risk.
Definitely. And here's the one that seems to catch so many people off guard, and our sources really emphasize this: peanut butter and other nut butters too.
Absolutely. This is a growing, serious concern. Because, peanut butter is such a popular treat we give to dogs.
Yeah.
If you happen to buy a brand that's started adding xylitol, often in their natural or sugar-free versions, maybe trying to lower the sugar content, you could be unknowingly poisoning your dog.
Wow.
You must check the ingredient list on your peanut butter jar every single time you buy it. Don't assume the brand you always buy is safe. Check it.
That's a habit every dog owner needs to adopt immediately.
Huh.
Okay, what else? Where else is it lurking?
Any diet or sugar-free baked goods, cookies, muffins, cakes, so especially things labeled keto-friendly or diabetic-friendly, those are prime suspects.
Good flag.
Also, beware that xylitol can be used as a sweetener in some medications, think chewable vitamins, some supplements, or even some liquid prescriptions like, say, gabapentin liquid or certain melatonin or probiotic formulations. It might be listed under inactive ingredients.
Sneaky. So you have to read the whole label.
The whole label. Protein bars, meal replacement shakes. Basically, if it's sugar-free and designed for humans, you need to check that label before it gets anywhere near your dog.
Okay.
And don't forget bulk xylitol sweetener that people might buy for baking at home. That stuff is highly concentrated and incredibly dangerous if a dog gets into the bag.
Right.
Even some sugar-free condiments and syrups like ketchup, barbecue sauce, pancake syrup can contain it sometimes.
So the takeaway here isn't just avoid sugar-free, is it? It's more specific.
Exactly. It's specifically look for the word xylitol, or sometimes it might just say sugar alcohol, on the ingredient list of anything that could potentially end up in your dog's mouth.
That list is eye-opening and, yeah, a little frightening. So, okay, if despite our best efforts, a dog does get into something containing xylitol, how do you recognize the signs? What should owners be watching for?
Right. The signs are going to depend somewhat on the dose they ingested and the specific product. And like we said, the timing can vary quite a bit.
So let's start with the low blood sugar effect, the hypoglycemia, which you said can happen really rapidly. What are the key indicators there?
Often, the very first sign is vomiting. That's a common early one. Then you might notice weakness, lethargy. Maybe they just seem really tired or sluggish.
Okay.
Difficulty walking is a big one. They might seem wobbly, uncoordinated, kind of staggering. It's called ataxia.
Ataxia, right.
This can progress to muscle tremors, and in severe cases of hypoglycemia, seizures can occur, or even collapsing coma. You might also notice their gums look paler than normal.
Okay, so vomiting, weakness, wobbliness, tremors, seizures, collapse, pale gums.
Got it. And what about the signs of liver failure, which you mentioned can be delayed?
Yeah, those usually show up later, maybe anywhere from 8 to 12 hours after ingestion, but sometimes it can take a couple of days, especially with higher doses.
Okay.
Signs here can include persistent vomiting, maybe they just completely lose their appetite, acting really depressed or unusually tired.
The most distinctive sign, if it develops, is jaundice. It's a yellowish tint to the skin. You might see it in the whites of the eyes or on the gums. That signals significant liver issues.
Jaundice, okay.
And because liver failure affects blood clotting, you might also notice unusual bruising, maybe tiny pinpoint bruises called petechiae, or larger splotches under the skin, ecchymosis.
Ah, the clotting issue.
Right. Sometimes there can be bleeding into the digestive tract, which might show up as black, tarry stools that's digested blood called melena, or maybe even visible fresh blood in the stool.
Okay.
In really severe cases, you might see fluid building up in the abdomen, making them look bloated. Or they could show confusion or disorientation if toxins are building up and affecting the brain. That's hepatic encephalopathy.
That's a lot to watch for, and some of those signs, like just being lethargic, are less obvious than, say, seizures. So if an owner suspects xylitol ingestion, maybe they saw the dog eat something, even if they don't see clear signs yet, what happens when they get to the vet? How is this actually diagnosed?
Okay, diagnosis relies heavily on the information you, the owner, can provide. This is where being that detective beforehand is so important.
Right.
Tell your vet everything the dog might have gotten into. Don't hold back thinking it's silly. Did you recently buy a new kind of peanut butter? Did you drop a piece of gum and can't find it? Did a guest leave a purse unattended?
Mm-hmm.
Look around for wrappers or packaging. If you can possibly bring the product packaging with you to the vet, that's incredibly helpful.
Why is the packaging so important?
Because the vet might be able to look at the ingredient list, see how much xylitol is in it, and estimate the maximum potential dose your dog could have ingested based on how much is missing. That helps gauge the risk for hypoglycemia versus liver failure.
Got it. So history is paramount. What else helps the vet confirm it's xylitol?
Well, the clinical signs themselves are a strong indicator, especially that rapid onset of low blood sugar symptoms. The wobbliness, the weakness.
Okay.
A quick blood glucose test is essential, right away. A rapid and significant drop in blood sugar is highly suggestive of xylitol.
Makes sense.
And if xylitol toxicity is suspected, the vet will continue to monitor that blood glucose very frequently, sometimes every hour or two initially, maybe stretching to every few hours later for at least 12 to 24 hours, sometimes longer, especially if a slow-release product might be involved.
Right, because of that delayed absorption possibility.
Exactly.
Yeah.
They'll also run more detailed blood work, usually a biochemistry panel. This checks on organ function, and they'll be looking particularly closely at the liver enzymes.
ALT, AST.
Yeah, ALT, AST, ALP, GGT, bilirubin, all those liver values. It's important to remember, though, that these enzymes might actually be normal right at the beginning, even if liver damage is starting. They might only start to rise hours, even a day or two later.
Okay, so serial testing is key there, too.
Definitely. They'll also check clotting times PT, APTT, to see how quickly the blood can form a clot, because liver failure impairs that. Our sources also mention vets will look for other clues in the blood work, like electrolyte imbalances, potassium or phosphorus can get out of whack, or potential issues with platelet counts, which can sometimes drop.
And I assume the vet might also need to rule out other potential problems, right? It might not always be xylitol.
Oh, absolutely. They'll consider other potential causes for low blood sugar, like maybe an accidental insulin overdose in a diabetic dog, or rare insulin-producing tumors called insulinomas,
Right.
or other causes of acute liver failure, like certain other toxins as acetaminophen poisoning or sago palm ingestion, for example. So part of the workup is ruling those other things out.
Okay. And imaging, like x-rays or ultrasound.
Not typically diagnostic for xylitol toxicity itself. There's nothing specific you'd see on an x-ray, but they might be used to check the overall health of the organs, look for fluid in the abdomen, or help rule out other problems that could cause similar signs.
So it's really a combination of the owner's information, the dog's symptoms, and then specific blood tests and careful monitoring over time. If xylitol toxicity is diagnosed, or even just strongly suspected, what does treatment involve? Our sources make it sound like speed is absolutely critical.
Absolutely. Cannot stress that enough. This is not something to wait and see about at home. It's a genuine veterinary emergency that requires aggressive and prompt treatment, ideally at an emergency clinic or a 24-hour veterinary hospital that can provide intensive care.
Okay. Is there anything an owner should do at home right away? Like, should they try to make the dog vomit?
Decontamination, like inducing vomiting or emesis, is only an option under very specific circumstances, and ideally only under veterinary guidance, like calling them, or poison control first.
Okay. When might it be considered?
It might be considered if the ingestion was definitely very recent. We're talking within the last 15 or 30 minutes, maybe an hour at most, and the dog is completely awake, alert, and showing no signs of wobbliness, lethargy, or any other neurological issues.
Right.
If they're already showing any signs of low blood sugar, like being unsteady, or if they seem sleepy, inducing vomiting is dangerous, there's a real risk they could inhale the vomit into their lungs, causing aspiration pneumonia, which is a whole other serious problem.
Okay, so very limited window, and only if they're totally asymptomatic. What about activated charcoal? We hear about that for other toxins.
Yeah, good question. Our sources are quite firm on this. Activated charcoal is generally not considered effective for xylitol.
Oh, really? Why not?
It just doesn't bind well to sugar alcohols like xylitol. So giving it typically doesn't help remove the toxin significantly, and it could even potentially delay more important treatments like getting IV fluids and dextrose started. So vets usually skip the charcoal for xylitol cases.
Okay, that's crucial information. So home care is very limited, maybe inducing vomiting in a very narrow window under guidance, but really, prompt professional help is essential. How do vets treat the low blood sugar, the hypoglycemia, once the dog gets there?
Right, managing the hypoglycemia is the immediate life-saving step. If the dog's blood sugar is low when they arrive, or if it drops while they're there, the vet will typically give an intravenous bolus of dextrose. That's essentially a quick shot of concentrated sugar solution directly into a vein.
To get the levels up fast.
Exactly, to rapidly raise the glucose level back towards normal. But that's usually just a temporary fix because the xylitol might still be triggering insulin release. So that bolus is usually followed by a constant rate infusion, or CRI, of dextrose mixed into their intravenous fluids.
A steady drip.
Yeah, think of the bolus as the emergency quick fix, and the CRI is a steady drip designed to continuously supply sugar and keep their blood glucose stable over hours, sometimes even for 12, 24, 48 hours or longer, depending on how long the xylitol's effects last.
And that requires constant monitoring, you mentioned.
Absolutely. Blood glucose levels need to be checked frequently, maybe every hour or two initially, then perhaps every 2 to 4 hours as things stabilize. The vet adjusts the rate of that dextrose infusion based on those readings,
Yeah.
aiming to keep the blood sugar in a safe, normal range.
Okay.
They might also need to supplement potassium in the IV fluids if the dog's potassium levels drop too low, which can sometimes happen with the insulin surge and fluid therapy.
Got it. Okay, so that handles the immediate blood sugar crisis. What about managing the liver side of things, if that's a concern based on the dose or if the liver enzymes start to climb?
Right. If the dog ingested a dose high enough to worry about liver damage, or if those liver enzymes start going up on blood tests, treatment shifts to supporting the liver and trying to prevent or manage complications.
Ugh, what does that involve?
It still involves aggressive IV fluid therapy to maintain hydration and support blood flow to the organs. But then they add specific medications aimed at helping the liver.
Like what?
These often include things called hepatoprotectants or antioxidants medications like S-adenosylmethionine, N-acetylcysteine, NAC, maybe vitamin E, sometimes there's sodium. These are designed to support liver cell function, reduce oxidative stress, and potentially limit further damage.
Okay, liver support drugs.
Yeah, and if there's evidence of clotting problems or even just a high risk, they'll often administer vitamin K1, which is essential for producing some clotting factors. They might also use medications to protect the stomach lining, like famotidine or omeprazole, because gastrointestinal upset or even ulcers can sometimes develop.
So it's really intensive supportive care for the liver, plus managing potential complications like bleeding or stomach issues.
Exactly. And they'll continue monitoring those liver enzymes and clotting times very closely, usually daily or even more often if needed. In severe cases where significant bleeding occurs, plasma transfusions might be necessary to supply missing clotting factors. Plus, general supportive care is ongoing anti-nausea meds for vomiting, keeping them warm, managing any seizures if they happen.
Wow, it sounds like a really serious, potentially expensive, and definitely demanding treatment course for both the dog and the vet team. What's the typical outcome or prognosis for a dog that's been treated for xylitol toxicity? Does it vary a lot?
It really does vary quite a bit. The prognosis depends heavily on several key factors.
Okay, what are the biggest indicators of how a dog is likely to do?
The dose ingested is a major one. Generally, dogs who ingest lower doses that only cause hypoglycemia, if they get prompt treatment before that hypoglycemia becomes too severe or causes secondary problems like brain injury from seizures,
Right.
those dogs usually have a good to excellent prognosis for full recovery. The faster treatment begins, the better the chance. Time is absolutely critical.
Okay, so dose and time to treatment are huge. What makes the prognosis worse?
What worsens the prognosis significantly is the development of severe liver failure. and particularly the onset of bleeding disorders, that coagulopathy we talked about. That indicates pretty severe liver damage.
Hmm.
Dogs that present with seizures already happening or show clear signs of severe liver damage like jaundice when they first arrive at the vet, they have a much more guarded or even poor outlook. Our sources also note that certain blood work findings, like very high phosphorus levels, can also be a poor prognostic indicator.
So, the severity of the signs when they get help and how quickly that help is sought are really crucial. Can dogs fully recover if they've had significant liver damage from xylitol?
Survival after significant xylitol-induced liver failure is possible, but it's definitely tougher. Those dogs that do survive may require long-term liver support medications and ongoing monitoring, perhaps dietary changes too, as the damage can sometimes be quite extensive and might not fully resolve.
Okay. Given the serious risks, the potential for severe complications, and the intensive treatment needed, it really underscores that prevention is the absolute best approach here.
Without a single doubt. This is where every single pet owner has the power to make a huge difference in their dog's safety. Prevention is everything with xylitol.
So let's really hammer this home. What are the absolute key takeaways you want listeners to remember about preventing this potentially fatal toxicity?
Okay, number one, be a diligent label reader. Make it a non-negotiable habit to always check the ingredient list of any human food, candy, dental product, vitamin, supplement, medication, anything your dog might possibly get access to. Specifically, look for the word xylitol. Sometimes it might say sugar alcohol, so watch for that too.
Read the label. Got it. Number 2.
Number 2, store anything containing xylitol securely and completely out of your dog's reach. Treat it like you would any prescription medication or household poison. Gum in your purse or backpack, candy in a dish on the coffee table, human toothpaste on the bathroom counter. Keep it all safely stowed away where your dog absolutely cannot get to it.
Secure storage. Makes sense. Number 3.
Number 3, be extra cautious and suspicious of products labeled sugar-free, low sugar, keto-friendly, or diabetic-friendly. Consider these labels a red flag that should prompt you to immediately flip it over and scrutinize that ingredient list for xylitol.
Treat those labels as a warning sign to investigate further.
And number 4, because it trips up so many people, and it's such a common dog treat, let's reiterate that peanut butter warning. There are many perfectly safe brands out there that dogs love, but you absolutely must check the label every single time you buy a jar to ensure xylitol hasn't been added. Don't assume your usual brand is safe forever.
Check the peanut butter label every time. Crucial. Anything else?
Yes, finally, and this is perhaps the most critical action point if prevention fails. If you ever suspect your dog has ingested xylitol, maybe you saw them eat something suspicious, maybe you just found a chewed-up gum wrapper, even if they seem perfectly fine at that moment, consider it an emergency.
Don't wait.
Do not wait. Contact your veterinarian or an animal poison control center immediately for guidance. Prompt veterinary attention even before signs develop can be truly life-saving and dramatically improves the prognosis. Don't wait for them to get wobbly or start vomiting. Call right away.
That's excellent advice. This deep dive has certainly been sobering, but also packed with vital information. So just to quickly recap the key points for everyone, we learned that xylitol, while safe for us, triggers a dangerous insulin surge in dogs. That leads to rapid, potentially severe low blood sugar or hypoglycemia. At higher doses, it can also cause delayed but devastating liver failure.
Right.
It's hiding in more places than ever. Think beyond just gum, especially check that peanut butter label. Recognizing signs like vomiting, weakness, wobbliness, or later yellowing skin or bruising is crucial.
Yeah.
Diagnosis relies heavily on the history you provide the vet, plus blood glucose and liver enzyme monitoring. Treatment requires aggressive, prompt veterinary support, primarily IV dextrose, to manage blood sugar and supportive care for the liver. Remember, activated charcoal isn't effective here.
Correct.
And the outcome really depends heavily on how much xylitol was eaten and, critically, how quickly treatment begins. So what does this all mean for you listening? It means vigilance is your best defense. Being aware of what's in the products you bring into your home, becoming a careful, consistent label reader, that's genuinely one of the most important things you can do to protect your dog in our modern world, full of, well, ubiquitous and sometimes hidden ingredients.
Yeah, and this really raises an important, broader question, doesn't it? As sugar substitutes become even more common in human products, not just for health reasons, but sometimes for cost or manufacturing reasons too, the potential for accidental exposure to substances that might be toxic to our pets just keeps growing.
That's a worrying thought.
It makes you wonder, how much more attention do we, as pet owners, need to pay to the ingredients in all the products around us? Recognizing that our dogs and cats rely entirely on our choices and our vigilance for their safety in this increasingly complex environment, where might the next unexpected hazard emerge? Something to think about.
A really powerful reminder of our responsibility. Thank you so much for joining us for this deep dive into xylitol toxicity in dogs. Stay informed, stay vigilant, and please keep your furry family members safe.